Mississippi today. So welcome to all of you who are here with us at Basil's downtown on a beautiful morning in Mississippi, very close to the Capitol, and many of you are online. So thank you for joining us that way. I do have exciting news. We have a top fan here this morning. I think you've made all three of our breakfasts, so I'm excited, and she expressed appreciation that we've been doing these. I think all our topics have been timely and certainly important to what's going on at the legislature this year. And we think it's important, as Lieutenant Governor Hoseman referenced in his comments at the closing of the first event, that we're here trying to get the news gathered so we can get it out to all 3 million Mississippians. So it's an important role that Mississippi Today fills in this community. So many of you here are donors and supporters. We're a nonprofit newsroom, and it's expensive to produce news. So thank you for supporting us and keeping that top of mind. So this morning we are talking about Medicaid expansion, and we have our political reporter Bobby Harrison here, so we're thrilled about that, and our special guest Corey Miller, who's the State Economist for Mississippi, and they're going to be talking about these issues that have been really under consideration here for many years in Mississippi, and where we are with it now. And also we'll take a few questions at the end. We had a few questions submitted online, so we'll get those considered at the end. So think about your questions, very informal. If you need something, get up. If you need me to bring you something, I'll be happy to. And just thank you for coming. I'll let you guys go.
Okay. Corey Miller, I appreciate you being here.
Good morning. Glad to be here.
And before we get started, let me just say that in a long line of state economists, you have been extremely accessible and transparent and willing to take all questions, no matter whether the people asking the questions were pure of heart or or had some hidden agenda. So we appreciate you being here taking our questions.
Thank you.
And having said that, now I'm going to just ask you hard questions to really make you mad. So we're talking about Medicaid expansion, but we're probably going to talk about a few other things too. But getting started on Medicaid expansion, what do you think of Medicaid expansion?
Well, I don't really have an opinion on it one way or another. The purpose of our report was not to take a position on Medicaid expansion. As State Economist and the University Research Center, we don't take positions on policy issues. We try to provide information, answer questions, do a lot of what-if analysis, and that's basically what the motivation behind doing this study was what if Mississippi were to enter Medicaid expansion? What do we think the outcomes would be in terms of economic effects and the fiscal effects to the state? That's what we tried to answer, the question we tried to answer in our study.
Just to be transparent myself, I knew you were going to say you don't take a position.
I appreciate you setting me up for
because
that.
you told me that many times. But you did do this study, and I think you and your colleague,
Yes, Dr. Sandra Collins.
Sandra Collins, fellow economist, and it had some interesting points in it. And so let's just kind of dive into those points. I mean, if I were in, without getting specific numbers, essentially the study indicated that or analysis is what I would call it, indicated that if Mississippi expanded Medicaid, it would grow the economy, jobs, wages, even population to a smaller extent, and also would provide health insurance to needy people, and would actually be a net gain to the state general fund, state budget, instead of a negative impact on the budget, as many people have said it would. So can you talk about those issues some?
Sure. Just to kind of get through the basics, what Medicaid expansion does under the Affordable Care Act is extends Medicaid coverage to adults, I believe, age 19 to 64, who are have household incomes below 138% of the federal poverty level. That would provide health care coverage, we estimate, to around 230,000 Mississippians. Some of them have coverage now through on Medicaid currently, or they may have coverage through the marketplace, and a few of them have coverage through employers. About a third of them have no coverage at all. It would provide Medicaid coverage to those individuals. The state would be responsible for 10% of the total cost at this point. The federal government under the Affordable Care Act as of 2020 would cover 90% of the cost. One of the reasons we decided to do this study last year, and URC actually did a study about 10 years ago on this. Former economist Dr. Bob Neal did a study on this, and we wanted to update that. And one of the reasons we wanted to update that was because of the American Rescue Plan that came out. Basically, the impact that has on Medicaid expansion to states that have not expanded is it increases the federal matching percentage of that on traditional Medicaid, the current Medicaid that we have, by 5 percentage points for 2 years. So that created another incentive for states to do that. What we found is that additional money that the federal government would be spending on health insurance in the state through Medicaid, as well as additional money being spent by the states, would have a positive effect economic effect on Mississippi. It would provide or would create additional jobs through that money. The state, our estimates are that savings to the state that would come through various means. Part of it is that additional federal match for the first 2 years. It would also be savings from moving current individuals, such as the disabled, for example, from current Medicaid coverage where the rate, reimbursement rate, basically, or matching rate is around 78%. They would be able to move to that
90%.
To the 90% coverage under the expansion. So that would create savings there. There are several groups there. The biggest amount of savings we found we think would be under reductions in uncompensated care costs to hospitals. And we can get into that a little bit later. But our estimates are that the cost of providing that coverage, the 10% that the state would be required to cover, would be basically offset by the savings each year, and then you have the additional funds from the match for first 2 years. So we think for the first 9 or 10 years, the state would not incur any additional costs based on our estimates.
Yeah, and just to make it clear, when you talk about that incentive in the American Rescue Plan, increasing the matching rate on the regular Medicaid program by 5%, I think those numbers are for 2 years. I think that's like $600 million, more than $600 million.
It's a little over $300 million a year the first 2 years by our estimate.
So we're talking about quite an incentive, and just to refresh everybody, Medicaid expansion was allowed in the Affordable Care Act, as Dr. Miller pointed out, and I think 38 of the 50 states have now expanded Medicaid. Mississippi is among those 12 that has not. And some people say that, there's probably more people in Mississippi who could benefit from Medicaid expansion because it's targeted primarily to the working poor. These are people who, for the most part, work, but they work in jobs where the employer doesn't provide health insurance, and they don't normally make enough to buy health insurance themselves, or if they do, it's very expensive for them. So, and those are just some of the background. A fascinating thing that I found out from reading your study was, and you referenced it just now, was that the people in the existing Medicaid program could switch over to the Medicaid expansion and actually save the state money, because in the existing program, the federal match rate is 78%. Under the Medicaid expansion, it would be 90%. So that would be quite a savings for the state right there.
Yes, and that's where a lot of states have received their savings. Trying to think what happens is the state is paying that cost, but they're able to move to the expansion because of the income. Right now, they may be on Medicaid because of they're disabled or pregnant or for other reasons, but they can move to the expansion coverage because of the income threshold.
Yeah, and Medicaid is kind of a complicated issue, and to further explain that, in Mississippi, we have what I think, I mean, compared to some other states, we had a very restrictive Medicaid program even before Medicaid expansion came along. In Mississippi, Medicaid, for the most part, covers poor pregnant women and children, the disabled, certain segments of the elderly population, and a small group of adult caregivers if they make, I mean, but they have to make a very minimal amount of money. It's very, if you make over just a little bit of money, you can't qualify to be on Medicaid as a caregiver. So if you're a healthy or even semi-healthy adult, and you can't afford to buy to have a health care program in Mississippi, you just kind of out of luck. And Medicaid expansion would fill that gap. And so and I think what Dr. Miller's referring, a pregnant woman, when she became pregnant, if she was under a certain income level, could qualify for Medicaid at 78% federal match. But if she was already on Medicaid expansion, she'd be getting that match at 90%, which obviously would save the state money. Is that a fair analysis?
Yes, yes. And same thing with some of those other groups like the disabled.
And how many people are on the regular Medicaid program? That's about,
I believe as of right now, it's around 700,000 or so, because part of what has happened since the pandemic started, and this is not really part of Medicaid expansion, but what has happened since the pandemic started, there's been declared a public health emergency because of that, and they have increased, the federal government has increased the matching rate for all states on traditional Medicaid right now, and as part of that, states are not allowed to basically kick anyone off the Medicaid rolls who became eligible as long as the public health emergency continues. And I think most observers think right now that'll probably be the end of this calendar year when that part ends. So right now so there hasn't been the normal churn in people coming on and going off because of that. So right now, I believe we're somewhat over 700,000.
And those people, they include postpartum mothers who, I mean, that's been an issue in the legislature,
right,
because I think our coverage for postpartum care on Medicaid is,
I believe it's 60 days.
60 days, and during that emergency you're referring to is a year, and now some members of the legislature, primarily the Senate leadership, is trying to extend it for a year after that federal state of emergency is concluded, and so far that has not passed the House. That's been an issue this legislative session. That was kind of a side note. But going back to your analysis in Medicaid expansion, there was a issue in some quarters that you did not factor in the Woodwork Effect when you did this analysis. First of all, what the heck is a Woodwork Effect?
The Woodwork Effect is the term used for, and this has happened when states started expanding Medicaid under the Affordable Care Act almost 10 years ago or so. People who were eligible for Medicaid, including traditional Medicaid, but weren't on it and may not have realized it, and because of all the publicity and attention the expansion got, they realized, oh, I qualify for Medicaid. I need to see, can I get on that? And so people start, quote, coming out of the woodwork that weren't there before. So part of the issue that has happened in some states that have expanded has been they end up with more people than they expected because of that effect. So the estimates tend to be, the estimates prior to expansion tended to be on the low side. As far as our estimates go, we've estimated around 230-something thousand would be added. If you look at several other studies, they're in that ballpark. When Dr. Bob Neal did his study back in 2012, he did a kind of a high base case, and then a base case, and then a low case. His base case was around 278,000, That number has been pretty steady across most of the studies that have specifically looked at Mississippi. Another thing about the Woodwork Effect, we may have already had a Woodwork Effect in Mississippi.
Because of the pandemic.
Well, not just because of the pandemic, but because of Medicaid expansion occurred throughout the country, and that brought attention to Medicaid, and people may have been able to sign up at that point because they found out about it. So at this point, we tend to think, and most studies tend to think, that because Medicaid has been around, Medicaid expansion has been around for over a decade now, the Woodwork Effect is possible, but we think it would be smaller than it would have been when states expanded some years ago.
Yeah, I think the studies that I've seen that have had the highest number is right around 300,000. So they're all sort of in that same ballpark. But I guess the question I have, and you can answer this if you want to, or you may not want to, what would be bad about if people qualify for Medicaid or Medicaid expansion? What would be bad if if they got, other than if they got on the program? I mean, it could actually end up being a benefit to the state, especially in terms of, you touched on a while ago, uncompensated care. And uncompensated care is, as I understand it, correct me if I'm wrong, is when you go to primarily to the emergency room or to the hospital, and when you're too sick and you just you have to go, and these people go with no health insurance, and the hospitals are obligated to care for them, which is an expense to them that they're never reimbursed for, and that's some of the savings that you would have by expanding Medicaid.
That's right. We estimated that, and based on looking at other studies and what's happened in other states, a conservative estimate would be a 25% reduction in those costs, which are, in Mississippi, are quite substantial. We have some of the highest uncompensated care costs in the country.
Because we have more people without health insurance per percentage-wise, or near the top.
Yes, and I believe when the Mississippi Hospital Association did a study a few years ago, they think it would be around 40 to 50% reduction in those costs. Now, in our study, one of the things I will clarify that we didn't mention and should have on uncompensated care costs is those were total uncompensated care costs to both public and private hospitals, not just the public hospitals that the state would be responsible for what basically becomes bad debts. But we do think by making a conservative estimate, we get at a reasonable number for those uncompensated care costs. And really, what we found in our study, those are as far as the savings go, those are the key to the whole expansion in terms of savings. Now, as far as having more people on Medicaid, whether you think that's good or bad is that's a philosophical question, I guess, or ideological question. We just kind of tried to look at what does this mean to the state in terms of cost and economic impacts. We did find it has positive impacts to the state of providing that coverage to additional population.
Did y'all look at Medicaid expansion as part of this study, or any other analysis in terms of what's happening in other states? Was that part of your analysis?
We did look at other states to kind of make comparisons in terms of are our savings comparable to what's happening in other states. And really the only two states in the South that have expanded Medicaid are Arkansas and Louisiana. Arkansas did it somewhat differently because they initially had a work requirement, and that is, having kept up with that lately, that was later disallowed by the Biden administration, and they've had to renegotiate how they did that. Louisiana expanded Medicaid, I believe, about 2016 or so through a executive order by the governor, and that's kind of the only other southern states we've looked at. Studies have found, I know in Louisiana, that they have been able to reduce. A recent study found their uncompensated care costs were reduced by about a third. They estimated, according to particular study I looked at under Medicaid expansion.
Yeah, I think the Hospital Association, which has come out in favor of Medicaid expansion, I think they were talking about and having, and I don't think this is impacted in your analysis, but I think they were talking about having some type of small copay for the recipients, which would, I guess, provide a little additional money to the state.
Yeah, and a number of states have done that that have expanded Medicaid, have done that to offset the cost to the state by requiring that copay.
But that was not part of your analysis.
No, we did not include. We just kind of did a straight expansion without looking at any type of waivers like they did in Arkansas. Just what was the basic expansion allowed under the Affordable Care Act?
So that would actually be an additional savings to the state, or additional money revenue stream for the state if it did expand Medicaid, if there was some type of small copay.
Yeah, if that was done.
Yeah. I want to expand a little bit, but before I do that, I want to ask you one more specific question about the study. A lot of people questioned how y'all came to the conclusion that there would be I think it would be relatively small, but a small, the Medicaid expansion would lead to a small increase in growth in the state population, which, of course, any growth in our population is welcome. And according to the 2020 census, we were one of, I think, 3 states to lose population. So we're looking to grow the population. So speak to that a little bit.
Basically, that's a function of the way we have a software program that does the economic impact analysis. I mentioned this many times. In different studies that we do, called the REMI model, Regional Economic Modeling Incorporated, the company that makes it. And that's kind of a function of the way it models the economic impacts. When you have an increase or decrease in employment, which we think would happen under this study, that tends to be associated with changes, and they're relatively small changes, both positive or negative, in the population. So that's kind of where it comes from. Additional jobs, people may move into the state, or losing jobs, they may move out of the state, and that's the way the model. If we put you to sleep, you should be awake now. So.
I think we're back on. Is everything okay? Okay. I think you were finished.
Yes. That was my.
Well, one, and we can talk about this study for days, but we're going to move on in a second. One other thing from the study related to the population growth, which I thought was the only sort of negative in terms of Medicaid expansion, is we essentially don't have the health care apparatus that is needed with expansion. Health care providers would be stretched. Can you talk a little bit about that?
Yeah, that's right. I mean, right now, Mississippi doesn't have enough health care personnel as it is, in terms of doctors, nurses, and other staff. So when we say, I think our estimate is around 11,000 jobs a year, and about 60% of those jobs would be in the healthcare sector. That's more of that's kind of a theoretical number, because you would have to find those people somewhere, because we don't have them now. Based on our current numbers of people working in the healthcare field, we'd have to increase that by about 5% a year. Now, if there is a sustained population or new population of patients, then that may be able to attract additional healthcare workers, either from out of state, or more people going into it within the state. But that is one caveat to our study. If you get health care insurance, it doesn't help you that much if you don't have anywhere to go to get health care. So, that's one caveat.
But, and did y'all hear that? I mean, and we haven't talked about the specific numbers that much, but 11,000 jobs per year, that's pretty, even if it's, even if there's a caveat that some of those jobs may go unfilled for a while as the state grows its healthcare workforce, but 11,000 jobs a year, that's pretty staggering number. That's, I mean, the state has given all sorts of incentives to attract companies to the state that employ much less than 11,000 people. So that's just a staggering number. I would encourage everyone who's watching or here to go online. First of all, go online at Mississippi Today and read our reporting on this study and other university research studies, but then also go and link to the studies themselves. And they're actually more exciting than we're making them sound here today. There's photographs and graphs and everything. But moving on to
Economists really like graphs, so we try to put those in there.
Yeah, journalists do too, because we can look at the graphs and I have to read, and I have to do a lot of reading and just say, whoa, there's what we need right here. And speaking of graphs, I'm glad that was a good segue, because you've done some other studies that are, and I kind of combined the studies. You did not do this, but
right.
But I think it's worth talking about. And an issue before the to be perfectly honest, and I mean, Medicaid expansion is not going to go anywhere this legislative session. I think it's an important issue, and I think it's worth talking about. But we're coming to the end of the session, and it's just the leadership's not going to go for it this year. But they are talking about tax cuts, and there's been several tax cut plans with the ultimate goal, at least by the House leadership, to eliminate the income tax over a period of years. And you've done studies or analysis of those tax cut plans. I mean, you hadn't done them all because the tax cut plans are changing so fast you can't keep up.
That's right.
But I was struck by one of the primary early tax cut plan of the House leadership that eliminated income tax, did some other stuff too. And you had graphs in that study showing the effects it would have on, wage growth, employment, population growth, GDP, and I think that's everything. And I just put that graph beside the graph for the impact that Medicaid expansion would have in the same categories. And every one of those categories, Medicaid expansion outperformed the tax cut. That was just a staggering optic to me to look at those two graphs and how Medicaid expansion would have a much more positive impact on the state economy and the state in general. Now, some people who are not enthralled with Medicaid expansion said, well, I said that you said stuff you didn't say, and I never said you said anything. I just said your graph said this. So am I wrong some way in what the graphs say? I'm putting you on the spot. I'm sorry.
Well, and again, I think, we don't take a position that Medicaid expansion is better than eliminating the income tax, or eliminating the income tax is better than than expanding Medicaid. What we did was to analyze what the effects of those would be. Again, like I say, if you philosophically think having more people on a government program like Medicaid is not a good thing, then obviously you're not going to look favorably on that. But what we tried to do was look at the economic and fiscal impacts of that. And there's basically two reasons why you see you see larger impacts from Medicaid expansion. One, you're talking about a lot more money. You're talking about over $1 billion a year, most of that being spent by the federal government. And that's the second part of that is that is money coming from outside the state. Whereas when you're looking at eliminating the income tax, that's about $2 billion or so total as of right now. And that is, you're basically moving money from the public sector to the private sector. So you're not, that's not, and that can have stimulative effects, but those effects we found are not as large as those under Medicaid expansion.
And so, I mean, the primary reason is just the money is the Medicaid expansion money is just such a large amount of money that it can't help but have such a positive impact on the state economy and jobs and all those things. And I'm going to open it up to see if there's any questions in just a minute, but just a few more things. So as a state economist, you do all these analysis, and you look at the sort of where the state's economy stands. Can you talk? I mean, right now we're in sort of a weird time, I think, in
Very
that
much so.
we have record revenues. I mean, and revenues just growing at a pace that I don't guess has ever been seen before. State revenues. Why is that going on?
Well, I mean, there's a couple of reasons. The biggest reason is the injection of federal money we've had since 2020 through first the CARES Act, and then we had a supplement to the CARES Act at the end of 2020, and then we had the American Rescue Plan at the beginning of around about this time last year. Yeah, the American Rescue Plan got passed. So that has injected a lot of money into the states. Mississippi is far from alone in terms of bringing in revenues. They are way up in a majority of the states because of that. The second part of that is we're coming off a recession. Normally you have a rebound after a recession. This time we had some pent-up demand because people were at home for a long stretch in 2020, and so part of the economy was shut down for a while. That varied across states, obviously. So you had that increase in demand, people going back to work, people having money to buy things, and spending has been an important part of why we have so much revenue. A lot of that has come through sales tax. People have had money to spend. We had a very good year, we think, in terms of economic growth in 2021, just like the nation did. The nation had its largest expansion since, I believe, about 1984 in a single year. We think, of course, the numbers aren't out quite yet. We think Mississippi's economy expanded more than 4% last year. That would be the largest since the mid-'90s, so in an individual year. Our employment has come back, and has come back in some ways better than the national employment numbers have. So all of that growth, and including fueled in large part by the federal money through the coronavirus assistance packages, have led to a lot of the revenue growth.
And is it fair to say that, I mean, we've had a good year economically, but we still, I mean, I've heard you talk about this before, in terms of workforce participation rates and some of those types of things. We're still lagging behind the nation as a whole, and I've heard you talk about, until we deal with some human capital issues, that's gonna be a hard trend to reverse.
Mm-hmm. That's right. That's a long-standing issue in Mississippi. We tend to have one of the lowest labor force participation rates. We're currently around 55%. We're still down, and the nation is still down from where it was prior to the pandemic. We were around 56% or so. I think the nation is down to around 62%. They were around 63, 64. So we still got people who have not come back to the workforce since the pandemic for various reasons, and without getting into all that. But yes, our numbers do tend to be low. We have, because of human capital, we have lower educational attainment. We have more people on disability. Health is, getting back to Medicaid expansion. Health care is part of human capital. people are not healthy, they can't work. So that's part of our longstanding issues with regard to labor force participation.
Okay, Michelle, maybe we could see if there's any questions out
I'm
there.
sure we've answered everything.
Yeah,
I can't be
yeah.
any questions at this point.
Dr. Miller, wanted to see if you could talk a little bit further. You both touched on it, but what some of these studies show as far as population growth. That always astounds me how you can suss that out from these economic models. But can you speak to population growth in both of these studies, what they showed?
You're talking about our Medicaid expansion study and the tax studies, or
Yes.
Oh, okay.
Well, population deltas changes in both of those.
Yeah. Again, like I was saying, it tends to be associated with the increase in employment. The way our econometric model analyzes what we describe as a shock to the economy, basically, and that doesn't not necessarily a negative thing. It's just a big change from the status quo. And obviously, Medicaid expansion would be that. Elimination of the income tax would be that. And so it analyzes that compared to what the status quo would be, assuming nothing else changed. And part of what we have found under our analysis of tax cut reductions, the way the model works is it reduces state expenditures. That tends to be associated with because so much of state expenditures go to employment, that tends to be associated with reduction in employment, and the way the model works, that also reduces population slightly. Now, whether that means, in the case of these our tax studies, does that reduction in expenditures actually lead to fewer people working? Is not necessarily so. It could be elimination of open positions. We've already seen some of that going on. So again, these changes in population tend to be relatively small, but because our population has been basically flat for the last decade or so, it tends to show up as a relatively large change, just looking at it compared to what we've seen in recent history.
Kind of a two-part question.
Yes, sir.
Have you attempted to quantify all of the federal dollars that have come into Mississippi the last 2 years? Over $5 billion we know on PPP loans. We had direct payments. We had farm subsidies, special loans to restaurants, increased unemployment benefits, et cetera, et cetera. Have you done anything to try to quantify that?
What I have looked at is our change in personal income to the state. In 2020, according to one of the federal agencies, we had a 26% increase in transfer payments, which is any money coming from the federal government. That we had an increase, and we had very little wage growth in 2020. So almost all of our increase in income in 2020 was coming from those transfer payments. That was a little over $8.5 billion, I think, in 2020. We had an increase in 2021. These numbers just came out this week. Increase in transfer payments around 8% in 2021. That was about a little over, I want to say, $3.5 billion. Our personal income in both of the last 2 years, 20 and 21, has gone up about 7%. The difference being in 21, we had transfer payments and we had some wage growth in 21, and some of that was due to the inflation we saw. But 7% growth in personal income is probably about double or so what we normally see in a typical year. So that's the extent of what we have look at quantifying that. I believe Lieutenant Governor said the other day, in the last 3 years, we've had a total of 35 billion come into the, is that right? Do I remember that correctly from what he said? Over the last 3 years. It's been a tremendous amount of money.
And my follow-up then, have you attempted to estimate the withdrawal effect of those funds not being available going forward?
We have estimates for this year in terms of wage growth. We think we will have wage growth of around 7% this year, but we think personal income is probably going to be relatively flat because of the decrease in transfer payments that we're expecting this year. We're expecting those to drop, obviously because we've kind of reached the end of that money. Now, people have had quite a bit of income growth, and some have talked about how people have been able to save that money. We think spending, at least and it's very hard to judge this stuff right now with everything going on. We think spending is going to continue so far through the inflation that really started kind of in the fourth quarter, really picking up by the fourth quarter of last year. People have continued to spend, and that's one reason prices have continued gone up, because people have had the money and they continue to spend. At some point, that is going to change, and I'm not exactly sure when. I'm not sure anybody has a good handle on when that's going to happen.
I want to ask about the proposal to eliminate the income tax.
Which one? There's been quite a few.
Well, in general, we pay, I think, around 5% of income, and there's a proposal to eliminate that. Is that correct?
Yes, that's our top rate on incomes above $10,000.
Yeah. 5%. So I hope we are all aware of what happened in Kansas when they did that on the advice of the economist Arthur Lafer, I think was the man's name. And the results were a disaster for the state of Kansas, and they reinstituted their income tax. Is there any reason to think that we would have a different outcome?
It tends to be done, phasing it in over time would lessen the blow somewhat in a particular year. I know one of the issues they had in Kansas was the pass-through to corporations. So because they eliminated taxes on individuals, or really reduced, I don't think they entirely eliminated their income tax, but they really lowered it, obviously. Because they did that, you had corporations that became LLCs, and so they weren't paying corporate tax anymore, and they were paying a much reduced rate on personal income. So that really exacerbated the effect of reducing the income taxes. So if you could avoid that situation, then that would not exacerbate the effects you would have from reductions in spending. I hope I answered your question there. I didn't want to get into too much numbers.
Yeah, it's a great talk. Question for
Thank you.
Dr. Miller, and kind of touched on it a moment ago, talked about the lack of health care providers. But I would ask you to speak maybe a little more in depth on Medicaid expansion in light of all of the hospital closings across the states over in recent years.
Well, I mean, part of the idea is if you could reduce those uncompensated care costs, then hospitals would be able to reduce their bad debts and have a better chance of staying open because of that funding. I know the Hospital Association has really pushed for Medicaid expansion in the state because they believe it would go a long way to keeping a lot of our rural hospitals open, and maybe even reopening some of those that have closed if they have a more reliable source of revenue.
So, Dr. Miller, tomorrow about this time, you're going to be speaking to a group not quite this distinguished to be the legislative leadership. Just a joke. It's
No
a
comment.
Joke. And you'll be making a revenue estimate to that group that they will either, they have the option to adopt or not adopt, but they'll adopt some type of estimate and then they'll start working to craft a state budget for the next budget year, which starts in July. Can you give us now? This estimate will be a compromise between you and four others, what I call financial experts: the state treasurer, the revenue commissioner, the legislative budget committee staff member, and the state fiscal officer. Can you give us a sneak peek of what that revenue estimate is going to be?
Well, if you've been paying attention to the news, you can see some of the thunder has already been stolen from our revenue estimate. Normally, we don't talk about it at all until that meeting, and I'm not going to get into the specific numbers, but yeah, I wouldn't want to appreciate you asking that question and bringing that up, because I don't make the revenue estimates myself. The way we've done it is through this consensus. It's a consensus estimate that is done by our revenue estimating group, which is kind of an informal group consisting of myself, excuse me, the Commissioner of Revenue, State Treasurer, Director of Department of Finance and Administration, Legislative Budget Office. I believe that's everyone, and people from those agencies. We get in a room together and we go back and forth on what we think those numbers are going to be by category for each year. We don't even try to set a total number. We just try to set the individual revenue sources: sales tax, income tax, corporate tax, and then we add those up at the end of the meeting, and that's the number we get, and that's the number we'll present to the Joint Legislative Budget Committee tomorrow. They will. I assume they're going to adopt our recommendation, but what they will do for 2023, that will become the sine die estimate, which means it's the estimate at the end of this current session that will be used going forward for fiscal year 23 in terms of setting budgets and appropriations.
So what did I not cover you want to talk about?
I think that was pretty thorough, actually.
Who's your baseball team?
In terms of
Major League.
Major League, I don't really have one. I like following.
I know you're a Mississippi State graduate.
I'm a Mississippi State graduate. Very, very happy with last year's results. Obviously, didn't know if I'd ever live to see that happen, but I enjoyed that. I think we may be paying for it this year. But yeah, I'm a proud Mississippi State graduate. So.
Well, I think I'm going to turn over to Marshall now. Is that right?
Yeah. I was going to ask you I've got a mic on. I was going to ask you what's the economic effect of Mississippi State winning the baseball thing, because I know a lot of people are happy, and probably because it seems like we spend more money whenever we win.
Yeah, I agree. Particularly, I think in Starkville, they probably had a outsized economic impact from that.
It's a huge
Beer sales?
Mm-hmm. Yeah, beer sales. Anyway, I was thinking about, I wanted you to have something to take away from today, obviously, and I thought about, showing you and your role as kind of the navigator of helping the crew. So this is what I came up with today. I've got you leading the charge as we're going down the river. And the caricature's a little weird because you were sideways.
That's
so
okay. That's okay. That's my,
but
that's
anyway,
my best
that's
side.
right there. So.
Thank you.
Sure. And let me take a picture of it, and then it'll be yours.
Great.
So.
And thank you for your time.
Okay.
Okay, I want to thank everybody for coming and also thank our sponsor, which is AARP. So we really appreciate that. And Basil's for welcoming us early in the morning for 3 times. The food's great. So if you're watching online, definitely, if we get a chance to do this again, come join us. The food's been great. So I really appreciate the time of Bobby and Dr. Miller this morning, and all of you taking time to come. And we hope to bring these back next year and also perhaps add some other more community public events as we go through the year. It's been a little difficult, but we're hoping to do more. So thank you and have a great day.